Now that we've drawn up our medication from our subcutaneous injection, we're going to now do the injection itself. So first, make sure you expose the administration site and clean that with an antiseptic pad. Usually that's going to be an alcohol swab. So now let's remove the protective sheath of the needle. So now we're going to use our non-dominant hand and grasp the skin around the injection site. So really here, all we're doing is taking that hand and kind of plumping up the skin to give us a nice surface area to inject. What we don't want to do is pinch really narrow because our hands can get in the way, or we don't want to pinch really hard because that can be uncomfortable for the patient. Next, we're going to take the needle and do it and inject in a very quick, smooth-like motion. So we have options. You can either go at a 45-degree angle or a 90-degree angle. So something to note, most of your patients of a healthy weight or maybe even a higher body mass index, you can go a full 90-degree angle because this is safe, and also remember how the length of those needles are, they're pretty short. Also, sometimes you need to consider you may need to use a 45-degree angle technique. Now this is less common because this is really going to be used on the patients that are maybe even emaciated, really underweight or under body mass index, or someone that's malnourished. So 45-degree angles injections are more rare. 90-degree angles are really going to be what you go by, and usually the most common. So now we're going to inject the medication and then release the skin held by your non-dominant hand. Then we can remove that needle quickly and smoothly and make sure we activate that needle safety promptly to withdraw the needle and make sure that needle is safe and covered and out of the way. Now that we've drawn up our medication, let's take a look at the actual injection itself. We want to make sure our patient's nice and comfortable, then we're going to choose our injection site. Now for this demonstration, I'm going to use the abdomen. Alright, so then I'm going to expose the site, but also try to leave the patient as covered as possible. So I only need to expose a little bit of the patient's abdomen to give this injection. So before I give the injection, I want to assess the site, make sure there's no wounds or scars on the place that I'm going to inject. Typically, we want to go at least about an inch out from the belly button, and anywhere here on the abdomen, we can go all the way to the love handles, if you will, on the side of the stomach. All right, so now we're going to prepare our site, and we're going to make sure we clean thoroughly. So this can be kind of cold for your patient, so make sure you scrub and clean your site appropriately. Then when we go to give the injection, I'm going to grasp the patient's skin and where I'm going to inject. So when I do that, I don't need to pinch really hard or pinch really narrow because I don't want to get my fingers in the way. I also don't want to make it painful for the patient. All right, so now let's also talk about the angle. Now my patient's at a healthy weight, so here we're going to go at a 90-degree angle. If my patients may be emaciated, malnourished, or have very little adipose tissue, we may need to consider going at a 45-degree angle. But for this demonstration, my patient, we're going to use a 90-degree angle, which is appropriate. All right, so now let's get ready for administration. Now this particular syringe I have in my hand, notice the orange cap. Now the great thing about this is universal for the sign that it's an insulin syringe. So you should only have insulin in an insulin syringe. So it's a little bit different for the fact that this is counted in units when you give insulin. So again, it's really important to pick the appropriate syringe for the right medication. All right, so notice that orange cap, think insulin. Okay, so now we're going to remove our cap. Notice when I pull it away from my body. I pull it away from the patient. I'm not pulling it this way, so where I accidentally stab myself. So please make sure you keep this nice and away from you and the patient. So I'm going to move this off and pull. So we also take care not to bend the needle. Then when I position this, everybody holds these differently. I want a nice firm grasp, and also notice how I have it. I want to do it to where when I've got a hold of that needle, I'm going to make a dart-like motion for our patient. So this is important because a lot of the times when we go to inject, we're very nervous about hurting the patient. Think about this as a needle. We want it to pierce the skin. It's nice and sharp, so don't forget about that dart motion anytime you give an injection. So don't forget to dart. All right, so now I'm going to take my non-dominant hand. I'm going to plump up the skin or the site just to give me a landmark and also make it a little bit more comfortable with my patient and go and inject. All right, I'm going to go ahead and give your insulin, sir. So notice I darted. Then I'm going to inject my medication, and now I'm going to slowly remove it, and then I can release the skin. As soon as I've injected, I want to make sure to activate that safety mechanism immediately. Now, I'm using this on the bedside table. This way it stays away from me, my patient. Also, notice we heard that click. That's the best way to know that it's locked and safe. So watch this. That's what we want, so this doesn't slide down and we know the needle's protected. Then after that, we want to make sure that we make sure the patient's not bleeding. Typically with a subcutaneous injection, they don't need a Band-Aid. We are not going to massage the site, and then we want to provide privacy back. Thank you so very much. And then provide patient comfort.